Well, hello folks, this is Giles Malone, back with you with Space Coast Medicine Magazine and SpaceCoastDaily.com. We're here today with the very lovely Billie Rae Harris from West Melbourne, Florida, and originally from West Virginia, right, Billie Rae?
That's right.
Well, we want to thank you for joining us today and sharing your experience regarding your treatment with Dr. Sprocks. And we really do appreciate it because you're going to help other ladies with their health questions and
Absolutely.
so on. So we want to thank you for doing that. Could you tell us a little bit about yourself, Billie Rae, in terms of your family and possibly a little bit about your son and daughter?
Well, I'm originally from West Virginia, and I'm a retired hairstylist, and I have two children, Eric and Trish, that live in Fairfax, Virginia, in the D.C. area. Mm-hmm. And recently I've been widowed since about Easter, actually, and but now retired and doing some volunteer work in the Melbourne area.
Great. I understand you're looking to volunteer at Holmes Regional Medical Center?
Yes, I am.
Well, that's wonderful. We recently covered a lot about those volunteers at the hospital. They do such amazing work, so we really...
Yes, they're very needed.
Yes, we appreciate that. And also you're doing some work on a political campaign, I understand?
That's right. I'm helping with the Mitt Romney campaign again.
Okay.
Hopefully we'll have better outcome this time.
Well, very good. Well, could you tell us a little bit about your some of the health issues you were having before you saw Dr. Sprocks and how those were affecting your daily life?
Well, I was having some pressure on the bladder and when I would go to the restroom, and I could just tell there was just something not quite right there in that area. So I was fortunate enough that I didn't wait too late. Mm-hmm. Early diagnosis is really important, and so therefore I went to her as soon as I could. Mm-hmm.
Okay, and tell us about your first impression about meeting Dr. Marja Sprocks and how you found her and her staff to be.
Well, I was really impressed the moment I walked in the door. They're very friendly but yet professional, and they made you feel right at ease. They explain things and give you lots of information, and were very prompt. I didn't have to wait long at all. And they were especially nice when my husband was in hospice and when he was ill. I had to get sitters, and they were very accommodating if I had to change appointments or make a special, trip or something. So, and she was just so friendly. I mean, you can be professional and personal at the same time, and she was certainly all those things and more. Mm-hmm. And so it really made me feel at ease to know that she was there for me, and not just medically, but I think emotionally as well.
Mm-hmm. And in past years, have you had male gynecologists in prior years in your life versus...
Yes.
Mm-hmm.
And I felt with this situation it was really important that she was female, and I could, it made a big difference to me, and I think it's the experiences that you have and can share.
Mm-hmm. That's very good. Yeah, that's what we're hearing from a lot of ladies. So you saw Dr. Sprocks about this issue, and then you ended up having a one-day surgery, is that right?
Yes, it was an outpatient surgery, and she explained how you'd be leaving and the issues you'd have to deal with. And there's some packing, there's a catheter, but that was very simplified. She explained it all, and I had no problems whatsoever. And she gave good directions, and I listened to her. That's the main thing. Listen to your doctor, explain to her your symptoms, and you have a good result.
Mm-hmm. And the actual recovery process after the surgery, about how long was that, and how was that experience?
It was about 6 weeks, and they tell you not to lift anything that's heavier than a gallon of milk, and I listened carefully to that because you don't want to take any chances. And so you just watch your diet a little closer, and I didn't swim for about 6 weeks, I guess. And but anytime you need any answers, any questions, she was there to answer them. And I did have one appointment I went in, and because I had some questions about another situation not related to the surgery. But she was so wonderful about that. I had a little bit of IBS stomach problems, and she told me what she knew about it and referred me to another doctor there too.
Wonderful, very good. And so now you're back to swimming again?
Yes, I'm back to my old self again.
Yeah.
And on paper, at least, they say I'm really healthy, and I exercise and I walk, and then I do about 20 laps a day.
20 laps a day. Wow, that's
or every
impressive.
other day if I got too busy.
Well, yeah, I'll have to take some lessons from you in that case. That's impressive. Well, and now going forward, what plans do you have I understand you're going to be doing some more volunteer work, and then obviously keeping up with the swimming and enjoying your life in West Melbourne.
That's right, yes. We have a good group of friends over 55, and I try to keep up with them, and we have fun at dinner parties and checking out the local area.
Great,
Yeah.
great. Well, do you have anything you'd like to tell other ladies out there regarding your experience with Dr. Sprock? What message would you have to them?
Well, as I tell all my friends, if you have a problem, don't wait until it gets worse, and go to someone that you can trust and rely on, and who's a good surgeon and a good person, and that's Dr. Sprock. And she's been very helpful to me, not just medically, but even emotionally. She was very supportive, and I just really appreciate her, and she's been a wonderful doctor and a wonderful friend.
Well, Billie Rae, I can't tell you how much we appreciate you coming in today and meeting with us to tell that story. It is very important that people find good doctors. There are good doctors out there, there are great doctors out there, and there are not so great doctors.
That's right.
And so when we learn of good ones, we like to share that story. But we couldn't do it without you, and thank you so much for coming in today.
Thank you for the opportunity. I appreciate it.
Yeah, and you enjoy your lunch in Cocoa Village.
I will try.
Thank you so much.
Thank you.